Thank you for joining me for a quick take about Cordyceps mushroom. My name is Jerry Angelini, and I am the owner of Supplement Science Education. And a quick orientation is that Supplement Science Education does not endorse any specific product or supplement company, and the webinars do not explicitly or implicitly intend to diagnose, treat, prevent, cure, or mitigate illness or disease. So if you have a medical condition, please consult your qualified healthcare practitioner. Cordyceps species are fungi that are entomopathogenic in their natural habitat. And this means that they use insects as hosts. There have been two major species of cordyceps used, Cordyceps militaris and Ophiocordyceps sinensis. And this was formerly known as Cordyceps sinensis. They're quite similar in their action. The minor difference is the subjective experience of physical warming to the body. Ophiocordyceps sinensis is noticeably stronger in that effect. The other difference is that Ophiocordyceps sinensis has a history of counterfeit contamination and adulteration. Cordyceps militaris is a more reliable and far less problematic ingredient. Cordyceps has a significant number of benefits. Cordyceps supports energy, vitality, athletic performance, recovery, and adaptation to stressors. Cordyceps supports respiratory function, graceful breathing, and oxygenation. It supports immune activation and pacification activity in the intestinal tract, the respiratory tract, and throughout the whole body. Cordyceps also supports nerve antioxidant activity, cognitive functioning, episodic memory, and processing speed. Cordyceps supports liver and kidney function, prostate comfort, urinary flow, bladder emptying. Cordyceps has animal data that suggests it may also support microbiome, probiotic, microflora proliferation, and glycemic balance. The main concern with products is making sure that they have been tested by U.S. independent labs for identity, heavy metal contamination, and microbiological and pesticide presence. Cordyceps is best sourced from U.S. growers, and this is for economic, carbon footprint, counterfeit, and contamination concerns that have been associated with internationally sourced cordyceps. Standardization markers for cordyceps are really not yet established. There are two being considered, cordycepin and cordycepic acid, but there's no recognized dosing schedule associated with either of them. Beta glucan content, although it's like a tagline, but for cordyceps, it's not usually considered important because of the lower concentration naturally present as compared to other mushrooms. Ask if a mushroom ingredient supplier or the company that sells the Cordyceps product has completed either cell studies or human clinical trials that focus on potential effectiveness of the product. We definitely want to always check the suggested serving size and directions for use on the label. You might want to take it with food if you have a sensitive digestion. Cordyceps is generally well tolerated, but you want to work with a practitioner if you're on medications for autoimmunity, if you have a bleeding disorder, or if you're on antiplatelet medication, you have a hormone-sensitive cancer, or a recipient of an organ transplant. Because cordyceps is energizing, it is best to take it in the morning and the early afternoon. If you take it at night, it might interrupt regular sleep cycles. And you really want to observe your individualized response to any supplement to determine if it's ultimately the right fit for you. All right, thank you for joining me for this quick take on cordyceps mushroom. If you have any further questions, you can email me at jerry@supplementscienceeducation.com. Have a great day.